The images that you're seeing of Hayward, George, and Weir are difficult to watch and gruesome. These athletes did not prepare for this. Sadly, a similar fate has occurred to a local hero and professional player from Canada, Tyler Ennis. A fracture is a breaking of the bone. There are different types of fractures. In these cases, for these professional athletes, they all suffered an oblique displaced compound fracture. Acute traumatic fractures that occur during sport are the result of direct overloading of the bone. Basically, the amount of force that is generated on the bone makes it snap. The force can come from above, the sides, or below. Stress fractures are the most common type of fractures that occur in athletes. But of course, the acute traumatic fracture is by far the most difficult for the athlete to comprehend. It requires surgical repair, an extensive rehab program, and it is difficult for the athlete and spectators to watch. Bone is a dynamic tissue, guys. I know that may be hard to grasp because we think of it bone as such a solid structure, but it can actually remodel itself in response to the applied loads to it. What that means is weight-bearing exercises can increase the ability for bone to withstand force. That is Wolff's Law. Wolff, 2 Fs. In the incidences of Hayward and Weir, and unfortunately Tyler, they were coming down on one leg with a lot of force. Their bones could not withstand that force and unfortunately crack. You saw what happened. There are two main options for surgical procedures to correct an acute traumatic fracture. There's either an internal fixation or an external fixation. With external fixation, pins or screws are inserted through the skin into the bone and held in place by an external frame or rod. This is the ideal option for an acute traumatic fracture with oblique displacement and open fracture. The typical bones that are involved are the tibia or the femur. This procedure also attends to the open wound caused from the bone piercing through the skin. The second surgical procedure is called an internal fixation. This is used to set a fracture. When there are bone fragments, it first needs to be repositioned into normal alignment. They are held together with special implants such as plates, screws, nails, or wires. There are special considerations for athletes with fractures when operative treatment is chosen. Extremes of physical size are commonly encountered and require additional preoperative planning. Specifically with basketball players, the size of the nails used to hold the broken bones in place would be inadequate. The limbs of most basketball players are longer and would require a larger size intermedullary nail. A second consideration that needs to be taken into account when the athlete returns to play is the high loads that are going to be applied to the limb when they are playing basketball. So, the load sharing fracture fixation is preferred to minimize the risk of subsequent fracture related to stress. What that basically means is that the implant needs to be removed after completing the first phase of eligibility or at the end of the first full season of competition, 1 year after the injury. The treatment options for acute traumatic fractures is surgical procedures. Goals of the athlete should be considered in making treatment recommendations. The second phase of treatment for an athlete who has sustained an acute traumatic fracture is the rehab phase. In my opinion, of course, this is the most important part. The physician managing this type of athlete needs to be aware of the level of play that he or she needs to return to. Minimizing immobilization time will allow an early return to conditioning and obviously back out on the court. Fractures in athletes are common and sport specific. Their injuries should be approached from a different perspective than those who occur in the general population. Tyler, we're wishing you the best of luck. Canada's behind you and we all know that you'll be back faster, stronger, and better. Bless up.